Okay, guys, now we're on to chapter 19. We're at week 5 right now. This one is called Assisting with Hygiene, Personal Care, Skin Care, and the Prevention of Pressure Injuries. Next slide is your objective. So pause the video and then write it down, or just know this is what they're going to be testing you on when you get your midterm and HESI exams. So here's the next slide. Structure of the skin. So you have the integumentary system that refers to your skin, your hair, your nails. You have sweat, of course, that comes from this, and sebaceous glands. The skin is your largest organ of the body. So there's two main layers. You have the epidermis, and then you have stratified epithelial tissue, melanocytes, which determine skin color. They do not contain blood vessels. So think about what you know about healthy skin. Like, what does that look like to you? What would a nurse understand from seeing a patient and knowing that they have healthy skin? Um, you want to be able to identify how a person is doing, and you can identify how a person is doing because of what their skin is presenting as. Um, you need to also understand and know what skin color looks appropriate, and this can be different from person to person. So I have melanin in my skin, so you need to know based on someone who has fair skin versus maybe a darker complexion is what they're presenting me to me as appropriate for their skin color. Um, of course, on more melanated skin, you may not be able to see like bruising or maybe redness in the skin as much as you would see in a fair complexion. So, like when you are in your clinical sites or when you are finally on the floor as a nurse, you might see how different people have different presentations. Um, I would say that you really do need to know things about the skin, that there's two layers. Um, you also want to be familiar with some of the medical vocabulary here. So if you don't know what epidermis is, you need to know what that is. If when you looked at the slide and you read the word integumentary and you didn't remember what that was, you need to take those words down and remember them. So our skin can also tell us how much hydration this patient has, as well as nutrition. So if it's looking dull or if it's looking very dry, you would know that the patient is dehydrated. So just keep those things in mind. You have the dermis, the corium. There's dense connective tissue. It's strong and elastic. There's blood vessels here, nerves, hair follicles, fibroblast glands. The hair and nails. This is actually dead keratin with no blood supply or nerve endings. So think about it for a second. If you touch your hair, and I'm not talking about the hair at the root of your head, but if you touch your hair and I'm pulling on it, I don't feel pain. That's because there's no blood supply here. There's no nerve endings. This is actually technically dead. It's being there's nutrients coming from our skin and our body cells that is providing for our hair to look healthy, but it's actually just dead keratin. So there's no supply that makes me feel pain or anything like that. Same with your nails, if you think about it. If I'm applying any type of pressure onto my nail, of course, if you put too much pressure, you're touching underneath what's there. But to the nail itself, if you squeeze it, if you apply any type of pain or pressure, you don't feel that really. You're not supposed to feel that because there's no blood supply there and there's no nerve endings. That's how you can kind of remember that. Um, the dermis is also inside your sebaceous gland. Sebaceous refers to oil. So if I'm ever saying something that doesn't sound familiar to you, maybe you forgot, that means that you don't know the word. When you're taking your exam, as I keep trying to repeat, they're going to use this verbiage. They're not going to use basic sixth grade language. They're going to use nurse language. So if there's ever words on the screen that you're like, I don't know what that is, look it up. So mucous membranes. They are not strictly part of the integumentary system. They line cavities or passageways of the body that open to the outside. They're made of epithelial tissue over a deeper layer of connective tissue. They protect against bacterial invasion. They secrete mucus. They absorb fluids and electrolytes. So, you want to identify structures of your body that are lined with the mucous membranes. So, I would take a second to maybe pause the video and think to yourself. If you don't know the answer, look it up, pause the video, and then I will answer as if you had paused the video already. So, your nostrils, think about your nostrils. If you look inside, it's pink and it's very fleshy looking. Same with the inside of your mouth, it is pink, very fleshy looking, and also in your rectum. So you can also absorb a medication through these mucous membranes. They pass very quickly. Um, those who do like drug abuse and stuff like that, think about how they use their nostrils. It's because it's a fast passageway, oftentimes. Same with the inside of the mouth. Um, You also, as I said in the previous slide, you want to remember that for darker complexions or darker skin tones, stuff like that, these areas might look different. They may be colored different than somebody who has a lighter skin tone. Um, and think about how you don't want to line mucus because they're very sensitive, right? They absorb and they can be packed dangerously. So you want to remember how there's potential problems of prolonged packing in mucous membrane areas. As it said in the slide here, it's not strictly part of the integumentary system. There's other systems where you will see mucous membrane. For example, those who wear tampons or women, females that wear tampons, um, there can be potential problems if you have a tampon in for very long. That's because that area is dense with mucous membrane. It can absorb a lot. So if it becomes infectious or it's stayed for too long, your body is starting to absorb that there. Same with your nostrils. So sometimes people do nasal packing and stuff like that. You don't want to do any type of prolonged packing dressings or anything of those sorts in mucous membranes because it's very sensitive. So this is just a visual here that you can just take a look at so you can see the different layers. I think it's really important to just see how, just to visualize how the skin looks. I think for skin, it's very helpful to have these types of diagrams. So you want to know epidermis is at the top. Think of epi, the prefix means on top or above. You have the dermis, which is the under layers there, and then you have subcutaneous tissue. So functions of the skin, you absolutely need to know this. It's your first line of defense against bacteria and other organisms. It protects against thermal, which means heat or temperature, chemical, and mechanical injuries. So think about it. What do we present on the outside? We don't present our inner organs. We actually present our skin. So that is our first shield, if you will. Sebaceous glands, they make the skin waterproof. So sebaceous, I said earlier, refers to oil. So think about how water is repulsed by oil. Think about if you have oil on your skin or in your hair, stuff like that, and you drop water on it, it just immediately kind of slides off. Those sebaceous glands are found in our skin, and that's how our skin also protects and keeps it waterproof. Um, so that's why when we take a shower, water doesn't just come into our body like that. It has a protective gland there. So sensation for functions of the skin, it contains sensory organs for touch, pain, heat, and cold. And then temperature regulation, your skin regulates your temperature by constricting or dilating blood vessels and activating or inactivating sweat glands. So I think I have said this in a different slide. If you do not know what constricting or dilation of blood vessels are, you absolutely need to understand and know that concept. So if you don't know it, you need to probably go on YouTube and watch some type of introductory to what that means. So I mentioned in that first bullet point, it's your first line of defense against bacteria and other organisms, and it protects you. Um, think about how much your skin really does protect you. Um, our skin is what has sensation to protect us from knowing something is too hot and we need to move away, or too cold, we need to vasoconstrict or vasodilate, as well as understanding pain. Our skin has the sensation to feel pain, and it tells our body and makes our body react to move away, stuff like that. So it's really interesting if you think about it. For our next slide, you want to also think about what are some problems that would happen if we lost our sense of touch? How would that make things dangerous for us? So you can look at the slide and then kind of connect the answers there. Um, think about also too, because this slide doesn't refer to emotional effects when it comes to the skin. So think about touch. Skin is a very sensuous organ. So if I touch a patient who is in distress, or think about how when you touch a family member when they're feeling distress, immediately there are calming sensations that the skin can sense. So just very interesting. I've always found the skin very interesting. Okay. So functions of the skin: continued excretion and secretion. If you don't know what those are, you have to define those. So sweat glands help maintain the homeostasis of fluids and electrolytes. You have sweat glands. There's organs of excretion here. You also can secrete nitrogenous waste. Sweat glands are in the axilla, which is your armpit area. External genitalia secrete fatty acids and proteins. So sebum lubricates the skin and hair. Sebum keeps structures pliable and elastic. Sebum decreases heat loss, and sebum decreases bacterial growth. So as I keep trying to emphasize, if there's a word on the slide that you are not familiar with, you have to look it up. Sebum is referring to natural oils, as I had kind of had one over. Um, so sebum has a lot of protective roles as well. And of note, it's really interesting. Sebum actually contains vitamin E. There's fatty acids as well as antimicrobial properties, which can kind of help you protect yourself from infection. Skin changes occurring with aging. So as you are aging, or if you have any elderly in your life, there is loss of elastic fibers causing skin to wrinkle and sag. Skin becomes thinner, fragile, and slower to heal. There's decreased sebaceous activity. It leaves skin dry and itchy. Temperature control is altered by decreased sebaceous gland activity and thinner skin. So this is why elder populations, they often feel that they're cold. It's because their skin is literally thinning, so they do not feel that thermal protection, as we spoke about on the first slide. And then older populations, their sebaceous gland activity is decreased. So if you do not have that protective oil happening for you, um, temperature is also affected, as we talked about, but other areas as well, like thin skin and dry skin. So if you're not having natural oils, you're not going to feel moisturized or maybe hydrated as much as someone with younger skin. So hair also becomes thinner. It grows more slowly. It also loses color, and this is coming from loss of melanocytes. Melano refers to, or melano refers to color. Um, you also want to think about how, over the course of your life, how sunlight and UV rays affect your skin. Think about harmful agents and damaging agents as well, like tanning beds and chemicals that people apply to their face or their body. particularly a lot in cosmetic instances. You also want to understand why is nutrition so important to healthy skin and how does that affect healthy skin. Um, so there's assessment here, which is our data collection, hygiene and pressure injury risk. So hygiene, it's proper care of skin, hair, teeth, and nails, protecting the body from infection and disease. There's factors affecting hygiene practices. So socioeconomic background, if you do not have money to take care of yourself, how can you do that effectively? Economic status, knowledge level. Some people were not raised, or a lot of cultures, first generational children, stuff like that. Maybe they did not have those resources in their countries, and they do not know how to properly take care of their parts of their body. This is more common than people think. So remember, when you are a nurse and just in general a nice human being, you always want to remember some people may not know what you know, and you may think that this is common sense, but the truth is, not everybody has the same upbringing, as well as the same culture, the same background, the same financial situation. So some people may not even know basic things that you feel like everybody should know. Um, so this will also apply to your patients. You will see this often. I see this often as a nurse. And you always want to assess, of course, what their level is and what they have been taught, and be sensitive to that, and then try to add on to what their routine is. You also want to assess what is their ability to perform self-care. Do they need help as a patient? Personal preferences, as I kind of spoke about already, and then self-care abilities. Um, Repetition of 2 bullet points, and then cultural differences, as I already touched on as well. Um, Something that I would have noted here is mental health. So my clients specifically, a lot of them neglect these areas. And when you're not feeling good and you're kind of in a big state of grief, oftentimes people neglect this part of their body. Um, so think about how hygiene can also drastically change when someone is emotionally unavailable. And then also think about how hygiene can improve mental and physical health. So take a second, answer that into your head, think about it. This is how you actively learn and actively process as a nurse. Um, if you do not take proper care of your skin, you will see increased infection. You will also see like things like acne, blackheads, different things, as well as staph, which is a bacterial flora. So that will increase on the skin. Um, Also think about for nails, how much microorganisms stay under your nails. Um, We'll continue. So skin assessment, the bath offers opportunity for assessment, condition of patient's skin, overall physical appearance, emotional status, mental status, learning needs. So when you are offering a patient a bath, or say they are taking a shower, this is when you want to really take a full look at their skin, because you will be seeing them kind of unclothed, of course. So this is the moment where you want to see, do they have any lesions? Are there any infections happening? For women, especially if you are heavy chested, stuff like that, you want to always lift your breasts so that you can see under there. There are a lot of patients, despite what their age is, that neglect those areas, and you will actually see lots of bumps and infection under there. And a lot of the times, some of these patients don't even know that they're there because they are not lifting under there. And just like any areas with big folds, so those of us that have a belly like me, um, there are just areas in your skin where things can kind of be um, areas where you can potentially breed infection or have lack of good hygiene. So you just want to make sure when you have your patient in front of you, you are assessing different areas of the skin. A lot of older clients too, they can be overweight. So there will be several areas where you will kind of have to make sure you're checking great. So skin and pressure injuries. A pressure injury is an injury that forms from a local interference with circulation. Skin blanches or becomes pale. If interference, which is pressure, removed, skin becomes darker as blood supply returns. Reactive hyperemia. So, what is reactive hyperemia? This is the process where the blood is rushing to a place where there was decreased circulation. Um, Pressure injuries, of course, is a common issue in long-term care. So, this is something that you definitely want to understand. How does it happen? Um, so, this is risks factors for pressure injuries. You want to take a note of this slide and familiarize yourself with these instances. Um, Many times when you are taking your NCLEX or doing study style quizzes and stuff like that, preparing yourself to be an RN, they will have lists like this. You would want to know generally what would I see from a patient who has pressure injuries. So this is a good list here. How can lack of proper nutrition cause injuries as well? So if you do not have proper calories, you're not going to get enough protein, you're not going to get enough fluid, you're not having enough vitamins. Um, this allows your body cells and the capillaries that provide nutrition to your tissues. This is how they're easily damaged. So some risk factors here, it's immobility, lack of moving, incontinence. Imagine that you are constantly wet in your pamper or diaper. You're not being changed. And the skin is constantly staying wet, moist, and accessible to infection as well as accessible to shearing. Say they're getting pushed and pulled by their care team to be moving and positioning and all those things. If they are wet, their skin is mushy, their skin is frail. You will see way more pressure injuries in these patients. Diaphoresis, inadequate nutrition we covered on, lowered mental awareness. Some of these patients are not in the right mind, their right mind, so they will not even know that they are experiencing pressure injuries. Sometimes they will not even know that they have a big, massive pressure injury, like this big. You will see a lot of older clients, they are not mentally aware, they will not know that they're in pain. So that is why it is the nurse's responsibility to make sure they're assessing and not just going based off of what a patient is telling you. Excessive diaphoresis, extreme age, and then edema, which is swelling. So um, try to take a good look at this list, pause the slide, and then make sure you understand it and can recognize these. So you want to perform a skin assessment for pressure injury on admission. The reason why you do this before admission or on admission is you need to know what the patient's skin looked like before they got there. You need to document that. This happens for every patient in every facility, so I'm doing this myself. You will do this in every facility you work on, so this is why it's really important. After you initially assess, you actually have to reassess every 24 hours. So the reason why it's important to do this on admission is because if anything is found or seen, you know that that patient had it already. Say you never documented it, and then 3 days later, you see, oh wow, they have a huge, massive pressure injury, or maybe it's an itty bitty little tiny dime-sized one. Um, it will be as if that problem happened under your care or under their stay in the hospital or the long-term care facility. And you can get in trouble for not noting these things. So they use something called a Braden scale. I'm using this where I work, and you'll use this where you work. It's to predict pressure sores risk. So you have a bunch of questions on your electronic medical record, and you will be clicking, is my patient this, is my patient that? That's kind of how it goes down. And then you will get prompted a score. The score will tell you how likely it is that that patient may experience a pressure sore risk. I've mentioned before, I think at some point, that it's really important for us to know where bony prominences are. So when your bone is prominent, which means it's very, very obvious. So like right here, um, this is where you can get a pressure injury. It's because think about it, the bone is like pushing down. So Those are areas where skin is kind of fragile. You always want to check these areas when you're turning and repositioning a patient because you're not just going to come into the room and say, okay, well, right now I'm going to toss and turn you around because I need to see these areas. No, you have to do this kind of all together holistically as a nurse when you are doing comprehensive assessments as well as spending time with them for different reasons. You should be doing many things at once. It's an interesting and hard job, but that's just kind of part of it. You are assessing multiple things at the same time. So there's different stages of pressure injuries. You will need to know this. Number one, so stage one, it's an area of reddened skin that does not blanch when touched. So discoloration in people with dark skin, warm edema, or induration may be present. Stage two, you see partial thickness skin loss. So it may look like an abrasion or a blister, shallow little hole or crater. And you see that the surrounding skin of that loss or that blister or abrasion, whatever you observe, is it looks warmer, and it's because there's inflammation. You're going to see a lot of disgusting slides coming up, so brace yourself. Stage three, there's full thickness skin loss. Loss looks like a deep crater. It may extend into fascia, subcutaneous tissues damaged or necrotic. Stage four, full thickness skin loss with extensive tissue necrosis or damage to muscle or supporting structures may appear dry and black. So I'm going to go back on stage one again. You want to take note of what does friction mean, what would it look like, and how would it also affect skin. And then you also want to think about different interventions to prevent friction. So think about it, your patient's going to be around a lot of sheets and different devices that you will be moving them with and stuff like that. So just take note of that. And then on this slide, think about how older adults, they have an increased risk of developing impaired skin integrity from normal aging changes. We just kind of covered that. They have thinner skin, less subcutaneous fat. They have those decrease in sebaceous gland activity and decreased elasticity in their skin. So these were the pictures I'm talking about. So the 4 stages of the pressure injuries, you see this here. So that first one's not that bad. Second one, kind of forming. Third one, crater-like shape. So number 1 picture, which is A, that is your pressure injury stage 1. So you see how it's lightly pigmented. There's redness. If you are starting to see these signs, you have to intervene as a nurse. You will get in trouble if you do not. There are many interventions for these things, but the earlier it's caught, the better it is. By the time you get to somewhere like stage B, even, it will be very hard for an older client to recover from this. I think some of us may know this or have seen this already. Stage C, this is very difficult and extremely painful for a patient. Think about that. Look at it. It's a crater in your body. So we're gonna go on to the next slide. It also looks really bad. So brace yourself. This is stage 4 here. This happens. You will see this. You will have to tend to this. You'll probably see this a lot. This is stage 4. And then you have an unstageable pressure injury, which is picture E. There's dark eschar, the blackness there, that is necrotic, necrosis. If you don't know what that is, you need to familiarize yourself with it. And then picture F, you see a deep tissue pressure injury. So in those instances, you might even see the bone, which is insane. So prevention of pressure injuries, you need to know this. Excellent nursing care is the main factor in preventing pressure injuries. It is true. So if you are constantly making sure that your patient has ate, drank water, they have mobility, you are doing active exercises with them or instructing your CNA to take time to do this, having them walk around the unit, stuff like that can help them prevent pressure injuries. If you are a negligent nurse and you're letting your patient sit in the bed all day, your patient's going to have a pressure injury and you're going to make your workday a lot harder because you didn't take the time out to just do these first steps that I talked to you about. And also think about like how I said, how painful that is for a patient to have those pressure injuries. So it's really our responsibility to make sure our patients are active so that this doesn't happen. Even a little dime size of a pressure injury is very painful. It's your responsibility to be aware of risk factors that your patient has. It is your responsibility. You will get in trouble. And you have to try your best to lessen them. Prevention is less time consuming, I just said that, and expensive than pressure injury treatment. You want to assess the skin carefully and frequently. So, as I kind of said already, if you tend to it and you're making sure that your patient is on point, you will have a way smoother experience. But if you did not tend to your patient and tend to their physical needs, they're going to develop a pressure injury, and you're going to now have to spend way more time as a nurse in your day to um, tend to those wounds, assess those wounds, document those wounds, clean those wounds multiple times a day. So that's why I just be safe, be smart, and care about your patient as well. Um, you will also need to educate your patient a lot, especially if they're an older client. They may need a lot more of support and of a push for you to say, hey, I need you to move your body. Hey, I need you to sit on your left side for 2 hours. I need you to sit on your right side for another 2 hours. A lot of them, of course, will be stubborn and they will not understand why it's so important. But pressure injuries can happen to anybody. It can even happen to somebody in their 20s, 30s, 40s, 50s. It's not exclusive to age. Um, you want to, as I had mentioned, position at least every 2 hours, keep heels of immobile patients off the bed. So you don't want somebody who's not moving at all, their heels just nice and flat and firm on the bed all day. No, you have to make sure that their heels are above the bed. There are different devices that we use to make sure that the heels of a patient's feet are not just remaining on the bed. Sometimes you will put a pillow, stuff like that. Avoid positioning directly on the trochanter. Use trapeze or lift sheet to change position. Use pressure reducing devices such as foam pads or mattresses. Use pressure reducing devices for patients in wheelchairs. Shift weight at least once an hour, preferably every 15 minutes. Restore circulation by rubbing around a reddened area. So be careful when you are ever rubbing around or touching a patient who has these pressure injuries. I know it's said to restore circulation that way, but just be very careful. Do not, as I said, massage reddened skin or over a bony prominence. Wash and dry incontinent patients fast. You never want to leave your patient wet. Number one, for nursing negligence, you should never do that. Number two, for patient dignity, you never do that. You would never want your family member or your child to ever just be left in a wet diaper. Um, you want to, of course, make sure that you avoid any mechanical injury from a cast, brace, stuff like that, and avoid skin injury caused by friction and shear from sheets, etc. And as I said, always have them eat and drink water throughout the day. So there's bed and cushion devices like air inflation and deflation pads, there's gel pads, water beds, foam pads for different things. Treatment and care for pressure injuries. Most effective treatment is via a team approach. So yes, it does take a lot of people. You will be working with your CNA and you're going to have to make sure your CNA does this work or that you're helping them do this work too. So you also want to let the patient know, the family members or caregivers in their life, as well as any other healthcare providers. Initial care of a pressure injury is debridement, wound cleansing, and then an application of dressings. If the injury is infected, of course, they will have an antibiotic therapy going for this patient. Surgery may be needed to repair some of these pressure injuries. So you should always tell your patient what their options are for treatment, and they should always be encouraged to be active. The plan that you're going with to treat these injuries has to be consistent, and it also has to be a plan that the patient will follow according as well with their family preferences, goals, and what the patient's abilities are. Always educate the patient on how pressure injuries develop, how to prevent it, and then how to prevent additional injuries if they already have one. You should always have yourself inspect the patient during every shift for any type of inflammation, tissue destruction. As I said, you may be using antibiotics that are applied directly on the wound, but sometimes there are systemic IV antibiotics that they use for these types of wounds as well. Um, and sometimes they give skin grafts for this. So nursing diagnosis and problem identification, acute pain, chronic low self-esteem, chronic pain, dressing self-care deficit, imbalanced nutrition, lessened body requirements, impaired physical mobility, impaired skin integrity, ineffective peripheral tissue perfusion, risk for impaired skin integrity. So think about different ways that you would individualize a care plan for a patient. So these are not, this is not just a list that would go for everybody. It depends on um, what your patient's care plan was for them. So sometimes it can be because of their imbalanced nutrition, but that's not the case for everybody. Sometimes it's based on their lack of physical mobility, but as I said, that is not the case for every patient. So you would have to kind of identify a problem that is specific to your patient. It won't just be like a general it won't just be a general list that fits everybody. It's not like a one size fits all. So you would have to assess your patient, of course, as a nurse. So question number one, which of the following is not a function of the integumentary system? Number one, protection. Number two, provides color. Number three, temperature and regulation. And number four, excretion and secretion. So this might be tricky for you. I don't know, but maybe it is. Take a second to pause the video and answer the question. Read the question out loud in your head and read the answer choices out loud in your head. So if you're back, the correct answer for which of the following is not a function of the integumentary system. This was number two, provides color. Color is not one of the four functions of the integumentary system. Providing color is not the function of the integumentary system. The four functions was temperature, it was regulation, and it was excretion and secretion, as well as protection, sensation. So number two, Justin has a patient in a long-term care facility with a pressure injury. It can be described as full thickness skin loss that looks like a deep crater and extends to the fascia. Subcutaneous tissue is damaged. Which stage is this? So I would pause right here. You guys do need to know the different stages of pressure ulcers. You need to be able to identify them. It is not super easy, but once you just memorize it, you will know it. So what I would do if I was a student, I would make flashcards for the different stages, or maybe I'd make a Google Doc or something like that, a Quizlet, and I would apply the pictures and I would apply the descriptions and I would flip through it and I would quiz myself to make sure I know the different stages. You need to know this. You will get questions on this on your NCLEX to become a LPN or an RN. So you will need to know this. I knew I needed to know this when I was in school. So you have to memorize it. I'm saying it out loud that you have to memorize it. So the answer here, pause the video, do what you need to do, and then come back. But the answer here is answer number three. This is a stage 3 injury. Stage 1, this is an area of just redness. We saw the picture of the butt with all the redness around it. Stage 2, this involves partial, not full thickness, but partial thickness skin loss involving the epidermis and or dermis, which was our second layer. And then stage 3 was our correct answer, which is full thickness of skin loss that looks like a deep crater and extends to the fascia. And stage 4, it actually involves full thickness skin loss with extensive tissue necrosis or damage to the muscles, bone, or other structures. So this is your objectives for the next section. So to pause and take note of it. Again, for clinical practice, planning. So nursing goals for hygiene include the following. Patient's skin integrity will be maintained. Patient's hair is clean and neatly styled each day. Patient's mouth is intact and free from odor. So the data collected during the assessment will give you information you need to plan for hygiene care, right? So if you had to assess and you saw, okay, my patient needs to do blah, 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 you need to make a list and that's how you plan for them. So you want to also include the patient's ability to perform the hygiene tasks. Are they able to do it, or do they have a broken arm, or are they a stroke survivor, or um, do they have a nub for an arm and no hand, no fingers? So every patient's different. You also have to ask them what their preferences are or what their habits are. Um, you also need to take into account what is realistic for them. Are they going to do it? Are they going to do the plan that you came up with, or are you wasting your time? You need to make sure that it's something that they can still follow. Um, as I said, you need to educate a lot for this. So implementing bathing, there's four purposes. Cleanse the skin, promote comfort, stimulate circulation, remove waste products. Water should be warm but not burning the patient. You maybe need to either give a patient a partial bath or a complete bath. Provide comfort, safety, and privacy. So sometimes we will use a thermometer to make sure that the water is not too hot, especially in older clients. Their skin, as we said, is very thin and frail, and they may not feel a sensation of temperature. So the water might be boiling hot. Um, and they won't even feel it. And then you get them out of the shower and you see that their skin all of a sudden is completely red. That is because you let the water go too hot and too high, and you didn't realize that that is too hot for an older client. It might have felt good on your skin, but on their skin, it burned them. So just be very mindful of that and sensitive about that. There's a lot of different privacy issues also involved with bathing a patient, so you may battle some of those demons. You also want to always make sure that bed rails are up, especially if you're turning away from the patient. You also want the bed to be raised so that you're not breaking your back while you're trying to clean a patient. Maintain privacy, and then try to still make the environment warm if possible so that they're not freezing. So there's types of baths. There's one, which is cleansing. This is the most type. It's done in a bed, tub, or shower. Offer patient use of toilet before bathing. Of course, you want to ask them if they need to use the bathroom before you shower, because why would you ask them after? You may need assistive devices such as a shower chair or a stool. Think about too how you can make a bathroom safe before a patient even enters the bathroom. You don't want to just grab your patient, your vulnerable patient, and then come to the bathroom and realize, oh shit, there's like a bunch of stuff in the bathroom, and now we're about to go trip and fall in the bathroom, and it's gonna be your fault. So you always have to just kind of be proactive and make sure that everything is safe and looks good before your patient goes into any environment that you're about to go bring them in. They need to have that prepped. You need to do that as a nurse. Therapeutic bath. This is having healing or medicinal qualities. So sometimes a whirlpool bath. It's used to cleanse and stimulate peripheral circulation. There's sitz baths. These apply moist heat and cleansing to perineal area. Sometimes patients who have hemorrhoids use this as well. So you will see this. And sometimes you can add medication directly into the water. Then you have a sponge bath. This may be used to bring down fevers. So sitz bath, the purpose here is to apply moist heat and clean usually the perineal or anal area. Sometimes there's oatmeal baths, which is for patients with eczema or dermatitis. Um, Whirlpools are used for patients that maybe receive like wound care. This is for cleansing. Sitz baths also, you see this in OB, to soothe after a mother gives birth. And then sponge bath, um, this can help with fever reduction. You are not going to be able to always go and bring your patient and give them the full bath. So sometimes a sponge bath is just an immediate fix. So variations of the bed bath, bag bath, a variation of the bed bath, a self-contained bag containing several pre-moistened disposable cloths. Cloths are moistened with a cleansing agent that does not need rinsing. Cloths may be heated or used directly from the bag. The bag contains many cloths. So a different cloth would be used, of course, on a different body part. You don't just use one and do the whole body. Um, the cost of this system is the major disadvantage. So that's why the hospitals don't have this often, or even long-term care facilities where supplies are already limited. They are not going to pay for this. Um, Bathing the older adult, a full bath is not required every day. It's a personal preference and it must be considered. As I had mentioned in the first few slides, I'm going to ask you fill in the blank. Do older adults have increased or decreased sweat and sebaceous gland activity? Answer it. They have decreased sweat and sebaceous gland activity. So that is really why they don't technically need a bath every single day. Um, and their skin is thin. They have decreased fat, so sometimes they get too cold as well. So you don't want your patient to um, be in the cold frequently, or catch a illness or sickness from being in a cold bath often. So even if the water's warm, they will still feel some type of coolness because they have to get undressed. And that is making them vulnerable to the environment. So you, as I said, always want to pre-warm the bath area, make sure that everything is private. You have to have warm water, not hot, mild soap, and make sure that there's nothing in the area that would make the patient slip or fall because you will have a way longer day if that happens. Back massages. It communicates caring, it fosters trust in the nurse patient relationship, it provides the opportunity to assess skin on the back. You can stimulate circulation of blood to the area, reduces tension, promotes relaxation, should be performed with morning care and bedtime, essential for patients confined to the bed. So this is how to give an appropriate back rub. So you would want to place your patient onto one side. You can put warm lotion on your hands, and then you do smooth, gentle strokes to improve their blood flow. This is a non-pharmacologic intervention. So you will see that type of medical verbiage as well. So you need to be familiar with pharmacologic interventions as well as non-pharmacologic interventions in general as a nurse. Um, but in this instance, this back massage is a non-pharmacologic intervention that we do in the hospitals. Um, of course, you do not have to be like a masseuse and do something crazy, but touch is very comforting and stimulating. And there's a lot of these patients that never have any type of um, stimulation of their blood circulation like that from touch. So there are times where you may do this. I remember when I was in my early days of CNA and nursing in long-term care, I did do this for patients. It helps and it makes them feel good. So perennial care, proper draping helps promote comfort with the procedure. It may cause embarrassment to you and the patient as a result of your close contact with their private bits. So something I'm always teaching as an instructor and as a charge RN is like when you're performing any type of care where a patient is naked or a part of their body is exposed, even if it might not be a part of your body that makes you feel uncomfortable, you never know if that's something that they are struggling with or feel sensitive about. Even if it's something like their arm or their nose or their legs, maybe this was an insecurity of them, or maybe this is just something that is personal for them, their body. It is sacred. So something I'm always instructing and correcting is you never want to have conversations over a patient with your CNA or with any other fellow nurses, anybody in the healthcare team. You don't want to have conversations while you're cleaning them. Leave that for after you leave the room. Because, like I said, some of these clients are not in their complete mental state, whether that means they are either not alert and oriented, or two, they're highly sensitive, highly anxious, or maybe they're agitated, stressed. So you don't want to be having a conversation over them where they misinterpret that you're either one, laughing at them, number two, smiling about their situation or making conversation about their situation. Just like do your responsibilities and then leave your extra conversation for outside of the room. Um, you want to Of course, maintain a matter of fact attitude. This is kind of what I mean by I'm saying like do your task and then leave the room and do your conversations outside because anything can be perceived also as inappropriate. So they may also understand like, oh, was she suggesting something sexual or was she trying to be sexual when she was laughing or smiling or looking at me in a weird way? So just direct with, hey, I'm doing this task for you. We're going to take care of this. You do your task, and then that's it. Um, Mouth care. This is for the conscious patient. You have to raise the head of the bed 45 to 90 degrees. You need to know that. You cannot do mouth care while the patient is flat. Ask yourself why. Answer that question in your head. You should know why. Place a towel under the chin. This is to not get their body or chest wet. Of course, moisture, like we talked about, can degrade the skin and leave it to injury. Moisten the toothbrush and spread it with toothpaste. You brush the gum line to the edge of the teeth. Have the patients rinse the mouth and spit. You will have these basins to do that. And then you provide them with a cloth or a tissue to wipe the mouth when they're finished. Of course, you are always using gloves when you're doing anything like that because this is air fluids. You need to have extreme care with somebody who has dentures. Dentures are very expensive. If you lose them, it's going to be a big problem. You want to also know how to clean dentures. I don't know if there is a slide here about that, but if there is not, you will need to take some time to just briefly look up how do I clean dentures. That way you are prepared if a question comes up like that. So this is mouth care for the unconscious patient. You need to provide full mouth care at least once every 8 hours. If the patient is mouth breathing, they need to be having care every 4 hours. So why would somebody who is mouth breathing need more frequent mouth care? Take a second to formulate these thoughts in your head. Why would that happen? Why would they need oral care more frequently if they're mouth breathing? So this is because your mouth, if you breathe from your mouth, some of you guys do this. If you breathe from your mouth, your tongue is really dry. So is your mouth, so is your lips. It becomes very crusty. It becomes very dehydrated in there. So mouth care needs to happen because it rehydrates the mouth and also it prevents crusting and bacteria to just breathe. Um, of course, remove dry secretions because they cause halitosis and may obstruct airflow. Moist swabbing of the mouth is done every 2 hours or as needed to maintain integrity of the oral cavity. Oral care, so this is the denture care. Denture should be cleaned to prevent irritation to the gums and infection. A patient may use an adhesive for a better fit. Care should be provided in the morning and at bedtime. So when dentures are not in the mouth, they need to be labeled and they need to be placed in a container with water or normal saline to keep them clean and moist. You don't want a patient to take their dentures out and just leave it on the meal tray or just leave it on the side of the bed or even leave it on their bed. You will find dentures in many crazy places. You have to put that away, stored, and labeled so that when it's time to put them back on, you know where it is, or else you're going to be spending 20 minutes of your shift trying to find it with them. Hair care, brushing and combing. Use clean brush or comb to brush from the scalp toward the hair ends to decrease pulling. Easier and more comfortable for patients to brush or comb small sections of hair at a time. So I think the ladies here know how to comb or brush hair. I would hope you do. Alcohol, astringents, or water may be used to loosen hair strands that are tangled or matted. So a lot of these patients spend a lot of time in their bed. So think about how your bed head looks like when you're sleeping and you wake up and the back of your hair is very coarse, dry, and just very completely crazy in the back. So some of these patients are in bed or they're bedridden a lot and their hair starts to become matted and tangled. You will need to use some products to untangle it. You should do this for your patient. It makes them feel a lot better when their hair is done. They will even treat you better and give you a better shift if that's more of a convenience thing for you. But it makes them feel happy. It makes them feel pretty. It makes them have self-esteem. It gives them dignity. So You want to also hold the hair when you're brushing or combing so that you're not just tugging and pulling down. You're holding the hair as you're combing so that you are providing stability and not pulling. So shampooing, it removes dirt, soil, blood, or solutions from hair, stimulates circulation of the scalp. It eases brushing and combing. It can be done in the shower. Shaving, this is removing of hair from the surface of the skin, facial legs, or axilla. Be gentle. Use short strokes with a safety razor. Um, so you can use the safety razor. You can also use an electric razor. Safety razors should not be used to shave a patient when they are using like a blood thinner. So I think CNAs here would probably know that. This is because if you nick them, a lot of the blood is going to come out and spill. Same with the patients who are undergoing something like chemotherapy because they're immunocompromised, or patients who have low blood count, or patients who are on aspirin therapy. You only want to use the razor that was designated for them. You're not sharing razors, nothing of that. And you cannot shave anybody's beard or style it or anybody's hair, cut anybody's hair unless you have informed consent to do so. If you alter their look in any way and you do not have proof that they said that you were allowed to do that, you are going to get in trouble because that needs informed consent to be done. So you cannot alter a patient's physical appearance by yourself because you think it'll look cute on them. Do not do that. Nail care, so trimming, you got to clean under their nails, and cuticle care is usually done with bath. You soak the nails in warm soapy water. You use an orange wood stick to clean under nails. Push cuticles back gently. You use nail clippers to cut toenails straight across. So toes of like diabetic patients or anybody with any type of circulatory disease, you do not cut at all without a physician's order. You cannot. So these are certain things where you may think or feel like it's second nature for you to just, oh, I'll just grab the clippers and I'll cut your toenails. It's no big deal. No, no, no. You got to like make sure absolutely before you do any alterations to a patient's body, is this safe for my patient? Um, Toenails are always cut across because this prevents them from growing in different directions. Um, and then you also need to observe the color of the nail beds. This will tell you circulation information in the extremity. So if you're seeing somebody's fingernails are nice and flush, I don't have nails on, so you can see it's nice and pink and flush. But if I then went to go assess the toes and you see that the toe color is like dark black or blue or dull looking, you may note, wow, this patient has poor circulation in their feet, or they may have circulatory deficits. I need to investigate this and I need to tell a doctor. So eye care glasses, use warm water and soft cloth to dry the glasses. Contacts, remove of contact lenses, wash your hands, of course. And then there's cleansing contact or cleaning contact lenses. This is cleaning solutions. You moisten the lens, you rub it gently between your fingers, and then you apply. So you always want to also assess your patients for any draining in their eyes, any crusting, any redness. Um, if you note anything like that, you want to try to remove it with a warm, damp cloth, washcloth for a few minutes just to try to soften it and see if it'll come out. You never want to force anything like that. So if it's not coming off, you are not going to scrape it off. You're not going to apply pressure and scrape it off. Do not do that. You will break their skin even more. Um, just be very mindful and careful. You don't want to fight it. So if it's not coming off, you don't do anything. If it looks like it's infected or anything abnormal, you of course tell your charge nurse or you tell the doctor. So artificial eye, it needs to be removed daily for cleaning. To remove, you pull down the lower eyelid and put a little pressure just below the eye. Cup your other hand below the eye to catch it as it moves out the socket. Cleanse with normal saline. So some patients will have artificial eyes. I've seen it myself. Ear care, hearing aids, cleaning the earpiece with soap and water daily to prevent buildup of wax and debris. Otherwise, they're not going to hear you. You never submerge hearing aids in water. You're only cleaning it with like a cloth, something like that. If they're not working, of course, you have to check and see what's going on. Evaluation. These evaluation statements indicating the expected outcomes for hygiene have been met, including the following. So patient has no evidence of redness, irritation, or breaks in skin integrity. Skin integrity is maintained. Hair is clean, neatly styled each day per patient preference. And then mucous membranes are pink and moist without signs or symptoms of irritation or odor. So the purpose of evaluation, of course, is determining whether the expected outcomes set during your planning stages have been met. You also need to get feedback from your patient. Is this working for you? Are you happy with these results? Can I change anything differently for you? Or what would make this better for you? How would you feel most like yourself? What can I do for you? That's what I would be asking. Question 3, which of the following is not one of the basic purposes of bathing? Number 1, cleanses the body. Number 2, promotes comfort. Number 3, stimulates conversation. Number 4, removes waste products. So take a second to think about it. So number 3, it's not to stimulate conversation. You're not taking them to the bath because you want to have a conversation while they're getting naked and getting themselves clean. The purpose is to clean the body, promote comfort through care, and then remove waste products. Which of the following is true regarding mouth care? So number 1, mouth care creates halitosis and dental caries. Number 2, an unconscious patient should be provided full mouth care at least every 24 hours. Number 3, when assisting a conscious patient with mouth care, you should raise the head of the bed 15 to 30 degrees. Number 4, denture should be kept in a labeled denture container with saline or water when not in the patient's mouth. So take a second and pause. This question, I do feel like if you are listening to the answer choices, you might think to yourself, I'm not really sure. So what I would do in this instance, if I read this question and I read all the answer choices and I was like, man, I'm not really sure. Number 4 to me looked correct. But if I read number 1, 2, and 3 and I didn't know that that was not true, I would go and I would explain why each one is wrong and I would give the correct rationale or the correct answer so it would match for true mouth care. That's how you learn. Okay, this is your last slide. This is question 5. Gary is a nurse. He's working in an acute care facility. His patient is a 20-year-old male who was in an automobile accident. He has blood and glass fragments in his hair, a fractured femur, a mild concussion, and is negative for any other health problems. Which of the following is not an appropriate nursing intervention? Number 1, shampooing the patient's hair and cutting any glass fragments out of his head and hair. Number 2, washing his feet and trimming his toenails. Number 3, asking the patient if he wants you to call any family or friends. Number 4, allowing the patient time to rest. So I touched on the answer. So pause and ask yourself, now that you've returned, number 1 is wrong. You know why it's wrong? Because you are not allowed to cut hair without informed consent. Remember, unless it is a immediate emergency, you are not allowed to do that. So everything else was a true appropriate nursing intervention. All right, guys, thank you guys for watching. And please make sure you review these slides. It's very important. Pressure injuries is very important for LPNs and RNs. So it is something that you need to master. All right, good luck.